Hi, this is Dr. Tatiana Herzog with Implant Center of Miami, and I'm here to tell you the 3 most commonly asked questions about dental bone grafting. The 3 most commonly asked questions are: number 1, are you put to sleep for a dental bone graft? How long does the procedure take? And what is a dental bone graft made out of? So the first question, are you put to sleep, is a really common question. But the truth is that a dental bone graft is something that's really very simple and doesn't take a lot of time. Although you may be a nervous patient and you might want some sort of sedation, there are different options for you. Most commonly, patients are just given a local anesthetic, and that's just a shot of typically lidocaine, and that's enough to receive a dental bone graft. You won't feel much, you won't even know that you're receiving a dental bone graft. The second thing that you can do is you can get nitrous oxide sedation, and this is called laughing gas, and it's like having a glass of wine or 2. Once it's removed from your system, then you'll feel back to normal and you can drive home. The next sedative is an oral sedation, and that is typically a pill that is administered by your dentist, and it will make you sleepy and drowsy and give you some amnesia for about 1 to 2 hours, and that's for patients who are really very nervous. And then the fourth medication is IV sedation. IV sedation is basically where you're sleeping and you don't remember anything that has happened. And this is for the patient who is really phobic of the dentist. So typically the patients will just have local anesthesia or lidocaine, and that's plenty for a bone graft. You can see some of my previous videos so you can actually see it being done, and you'll see it just takes about a few minutes. And that's the next question. So how long does a dental bone graft take? Well, the procedure will actually just take about 1 minute to 2 minutes if you're having a simple bone graft. And if you're having an extensive or advanced bone graft, such as a sinus augmentation, then that can take up to an hour. But the everyday dental bone graft that is included with an extraction typically just takes 1 to 2 minutes. So the procedure length is very short, but the healing time can be anywhere from 3 to 6 months or more. Typically, it's around 3 to 4 months. So we've gone over, are you put to sleep for a dental bone graft, and how long does the procedure take? But the third question, what is a dental bone graft made out of? So there are a few different types of dental bone grafting. Most commonly in the United States, we use allograft, which basically means that it is from a donor tissue. It's almost like a powder, and it comes in a vial, and it's just placed into the socket. So it's very simple and very safe. This bone has been tested and irradiated and typically would not transmit any disease. The next type of dental bone graft is from an animal donor, such as a pig or a cow, and this is typically used more in Europe and South America. It also has its uses in the United States. And the third type of dental bone graft is synthetic, which is typically made out of glycerin and not as effective, but again, has its uses. So again, what is the dental bone graft made out of? We have donor tissue from another human, we have from animals, and we have synthetic. So the 3 top questions about dental bone grafting: first, are you put to sleep? Well, now you know the answer. You really don't need to be put to sleep. Second, how long does the procedure take? Just a few minutes in the office and a few months of healing. And third, what is it made of? And typically it comes from a donor bank, which is very safe. This is Dr. Herzog from Implant Center of Miami. I hope you learned something with this video. Please like and subscribe and share it if you do.